Hi everyone, it's Dr. Chan here. In this episode, I'm going to teach you how to change your urine pH so that it helps prevent getting kidney stones in the future. We're going to talk about three things: 5 of the most common types of kidney stones and the urine pH environment that they tend to form in. Number 2, how to acidify or alkalinize your urine using common medicines, fruits, over-the-counter supplements. And then finally, number 3, how to check your urine pH at home using a simple urinalysis test strip that you can buy off the internet. First, let's do a quick high school chemistry review. pH, as you might remember, is a measure of how acidic or alkaline a substance is. It can range from 0 to 14, and in the middle is water, which is considered neutral with a pH of 7. Urine tends to run slightly acidic and has a pH of 6 to 7.5. Let's take a look at the 5 most common type of stone types and the urine pH environments that they tend to form in. There's 2 stones that tend to form in acidic urine: uric acid stones and cystine stones. And there's 2 stones that tend to form in alkaline urine: struvite or infection stones and calcium phosphate stones. Now, calcium oxalate stones, which are the most common type of stone to get, can actually form in any type of urine pH environment. Next, let's talk about some simple ways to change the urine pH. If you want to acidify your urine or lower the pH, you can take cranberry juice. Drinking about 16 ounces of this a day will lower the pH and make your urine more acidic. Other ways include eating more protein, specifically animal protein. This will also acidify your urine. Now, on the other hand, if you want to alkalinize your urine or make it more basic, then you can either take a medication like potassium citrate. This does require a doctor's prescription. There are some over-the-counter medications or over-the-counter supplements like calcium citrate. There's foods that you can eat like lemon or lime juice, which has citrates in it naturally. And then finally, changing your diet so that you're not eating so much animal protein. Next, let's talk about specifically where you want your urine pH to be depending on the stone type that you have. Hopefully, if you've had kidney stones before, they were able to get a hold of it and analyze it to figure out what type of kidney stone you have. So let's talk about the ones where you want to alkalinize the urine or make it more basic. The first one is the calcium oxalate stones. You want to try to actually get the pH to be above 6.5 with these. Next, uric acid stones. You want the pH to be above 6.5. What's interesting about these type of stones is that these are one of the few stones where you can actually dissolve the stone by changing the pH. And then finally, cystine stones. You want the pH of your urine to be above 7.5. Next, let's talk about the kidney stones where you need to acidify the urine or lower the pH. The first one is the calcium phosphate stones. You want to try to get the pH of these to be below 6.0. And finally, for the struvite stones, or basically the infection stones, you want to try to get the pH of this to be less than 7.0. So you might be wondering, how do you know if you're on the right track with your urine pH? One simple way is you can buy these urine dipsticks off Amazon.com or any other. My nurse Kim, she's going to kind of walk you through the process of how to use a urine dipstick and check your pH at home. After you've urinated in a cup, wear some gloves. Step 1, make sure that your test kit hasn't expired. Step 2, take one out of the container and try not to touch the reagent squares with your finger. Step 3, close the lid immediately to prevent oxidation. Step 4, dip the urine sample and make sure all the squares get submerged in the urine. Step 5, remove it immediately and then tap off any extra urine. Try to hold the stick horizontally and not vertically, otherwise it might cross-contaminate the reagents and bleed onto the other squares. Step 6, stick it onto the paper towel. Step 7, read the guide to determine what's positive and what's negative. Well, thanks so much for watching. I hope you learned something, and that by learning how to manage your urine pH, this will help you prevent getting more kidney stones in the future. If you learned something, please subscribe and click the alert button to be alerted on more future videos that hopefully will benefit you. Thanks and have an awesome day.